Thank you, Chair, and thank you to our guests today. Could I just direct the following question there to Professor Carney and Professor Staines, please? We had the aviation sector in here 2 weeks ago, and they were discussing the effect of COVID on the whole sector. Our two airlines are both hemorrhaging money, and certainly one of them, which used to be a national airline, is in severe difficulty. I think about 9% of the economy the aviation sector represents. Would you be prepared to kind of modify your plan to allow for random testing of patients, of airline passengers, I should say, coming into the country? So let's say if a flight has 200 passengers, that you'd pick out 10 or 20 or something like that and try and see what is the rate of infection on those, regardless whether they're coming from green zones or not.
I understand the point, Deputy, and thank you for the question. The problem with modern airline traffic is that you might have people in a plane who are coming from 40 different places, because they may all have got on a plane in Birmingham, but they could have come to Birmingham from literally the four corners of the world. So there is a real challenge with bringing airline traffic up to its previous levels. Airline freight is a different story. Air crews are of manageable number, but I don't see that there will be a return to the scale of passenger air traffic that we have been accustomed to for some time to come. And Mr. O'Brien might have a better idea about that than I would. In terms of testing, it is possible to do random testing. The problem with it is the test itself is about 70% reliable. Once you test a sample of, say, an airplane, for example, with an unreliable test, the reliability goes down another few notches in terms of answering the question, is there someone who can transmit COVID on the plane? There is enormous work being done on COVID testing, which I only dimly understand. So I would expect that the quality of testing will go up, the price and speed of testing will go down. But at the moment, with the tests we're currently using, I think most of us in public health would advocate testing everyone on the plane. And I appreciate very clearly the challenges that throws up for the industry.
Okay, thank you. You probably saw this morning that China has put an embargo on certain Brazilian products coming in because COVID was found on frozen Brazilian chicken. Is this something that we should be looking at here as well, the importation of frozen product, and whether there's any chance of contamination of people in the sector who are handling that, or the logistics people who are distributing it?
I'd have to defer that to someone who is an expert in the virus itself. It is possible to detect the virus long after it's dead. So you can find a positive test for the virus with no living virus. And the place you're most likely to find that is somewhere cold. So I really would have to ask somebody who was an expert in that area of viral spread, viral survival, what their thoughts are. I would not have thought it's a major contributor to our risks. It was suggested in the New Zealand outbreak of 2 days ago, but the direction of the investigation in New Zealand has now gone towards someone who broke their quarantine regulations and may have triggered the outbreak in Auckland by doing that.
Okay, thank you. Could I just ask Stan O'Brien a question there? You highlighted a pretty grim economic picture, but could I ask you, assuming that we continue on this path that we're on, and let's say most of the European countries therefore will probably do likewise, where we're trying to mitigate the disease, trace temporary lockdowns, all of this, what do you think the path to the ECB unwinding support to the European countries would be? What time frame, and how would that initially, I suppose, in terms of Ireland in particular, where would we be in the pecking order in terms of that support being removed?
Well, could I suggest I take the first part of that question and pass the second part to Mr. O'Brien? The first part is the economic damage is driven by the virus. It's instructive to compare Sweden and Denmark. Both have had significant economic damage, but Sweden more than Denmark. Sweden had no lockdown and very high death rates. Denmark had a lockdown and much lower death rates. Studies within the United States and within South Korea both suggest the same thing, that the regional economic damage was not driven by the government and state responses to the infection, but was driven very directly by the rate of infection itself. So I think that needs to be the focus. And as Susan Michie said, it is not the case that health and wealth are in opposition here. They really are pushing in the same direction. And I might pass the rest of it to Mr. O'Brien, who would know vastly more about it than I do.
Thank you. Yeah, I think there's extreme uncertainty about the relationship between the measures that were taken and the economic impact, and we just, there is still a lot of uncertainty around that. Just in general, in terms of the conversation, it's not clear to me that there is quite the sense of how serious this is economically. Recessions are extremely bad for countries. We know that in this country. We had a very bad one between 2008 and 2012. They call social, political, economic and health damage. This one also risks intergenerational conflict because, let's be absolutely clear, younger people are at a very low risk of death from this disease, and that, to my view, risks bringing out intergenerational conflict if younger people, who are always most severely damaged by recessions, end up in long-term mass unemployment because of what's happening. Specifically, your question about the ECB, the existing pandemic purchase program, which is effectively money printing for governments, is due to last into the spring of next year. So I think it is very unlikely that anything would happen to disrupt that, so governments should be free to borrow and spend until that point. Thereafter, I think some divisions between the member states may emerge in terms of the risks associated with money printing. Let's be clear, if money printing were the way of making everyone rich, poverty would have disappeared 500 years ago with the invention of printing presses. It is an emergency measure that will not go on forever. And we certainly wouldn't want to bank on it for a long time past next spring. And unfortunately, Ireland is not in a fantastic position, given that we go into this with quite a high level of debt, public debt already. So there is big uncertainty around how long that central banking support will last.